Welcome back to Across Louisiana. Well, they're the first name in healthcare here in the greater Baton Rouge area. It's the Mary Bird Perkins Our Lady of the Lake Cancer Center. And here to tell us about a focus today on head and neck cancer is Dr. Laura Hetzler. Welcome to the show, Doc.
Thank you so much.
How's it going today?
Pretty good, pretty good. Happy to be here.
For the people who may not realize the wide range of services that Mary Bird Perkins Our Lady of the Lake Cancer Centers has, tell the folks a little bit about the care you provide.
At the Cancer Center, we have multiple doctors, multiple physicians, and multiple ancillary staff, everybody there to help each individual patient, so that when we see a patient that has a certain type of cancer, we all meet all disciplines, surgeons, pathologists, radiation oncologists, hematology oncology doctors, and we discuss each individual patient to basically build a plan just for them.
Absolutely, a total team approach. But today we're focusing on head and neck cancer, maybe one that people don't always think about. Tell me a little bit about that.
So head and neck cancer is only diagnosed in about 60,000 people a year. Even though it is fairly rare, we at the Cancer Center are hoping that people will become more educated about it.
For folks who are out there watching this, I mean, who are your most likely people who are likely to contract that? Who's most at risk?
So those patients that have obvious risk factors are our patients that are significant smokers and drinkers. Smoking is a prominent risk factor in this population. Head and neck cancer only accounts for about 3% of all cancers throughout in every year. So cancers of the nasal cavity, cancers of the sinuses, mouth, throat, larynx, all of those cancers are more common in patients that are smokers and significant drinkers.
And I know a lot of times when people think about cancer patients, they always tend to be older or things like that, but we're not seeing that. Sometimes you see that in young patients as well, right?
There has been a shift in the trend, and it's interesting. It's still early on all of that data, but we are seeing with the idea of HPV or human papilloma virus related cancers, we are seeing those cancers in our younger population, and that's our message. Screening and education is what we're hoping for, so that if people know the risk factors, if they know the signs and symptoms, it is a rare cancer, but if caught early, it can be treated and can certainly be cured.
That's always a key component of your treatment, is getting that awareness out there and letting people know what they might be having to face, right? This is maybe a cancer that a lot of people don't automatically think of, but it's one that's very important that, as with all cancers, obviously, that you get early, right? Right,
absolutely. So even if you aren't a smoker and drinker, and certainly if you are, to a significant level, warning signs, areas on your lip or in your mouth, or dentures that used to fit that don't fit well, or areas that remain sore or ulcerated that aren't healing, those are some warning signs. Going to the dentist, your dentist, we get many referrals from dentists where they find these areas and send them to us for evaluation.
I know you mentioned the screenings earlier. Tell the folks where they can find out more about that, or where they can just go for more information on Mary Bird Perkins Our Lady of the Lake Cancer Centers.
Yes, at the website, believe it's www.mbpoll.org, or just Google Mary Bird Perkins, the Cancer Center, and you'll find all the information there.
Fantastic. Thanks for coming on and telling us all about it.
Thank you so much for having me.
So go out there and get screened, everybody. Well, that's going to do it for this edition of Across Louisiana. I'd like to thank all of our guests today, and have a great weekend, everybody.